An example of the other trials that I have ongoing is the RiME trial, and it's a trial looking at combining Nivolumab with Rucaparib, a PARP inhibitor, and Ramucirumab in the second-line setting in patients with gastric and advanced gastric and esophageal adenocarcinoma. And this is again a microsatellite-stable population. There's a rationale behind this approach. There's preclinical data and some clinical data on other disease types supporting clinical synergy when combining a PARP inhibitor with IO. And in this case, particularly in the upper GI population, we know that the VEGF pathway is active. And so Ramucirumab has solid data in second line that, and also has data supporting its synergy with an IO agents, and some data also supporting combining it with PARP inhibitors. And so we're looking at this triplet in a second line space. As far as it's an ongoing study, so we don't have any prelim results, but we are excited to explore it in a post-IO population now with the change in the IO space in the frontline setting with the approval of Nivolumab and pembrolizumab in combination with chemo based on Checkmate 649 and Keynote 590. We're looking at this as either a second-line regimen or a maintenance regimen down the road. And we're also exploring the regimen, so the design of the study will allow us to look at the regimen in the overall population, and also specifically at the population of patients with HRD mutations, so BRCA and BRCA-related mutations. And we anticipate that we're going to see better results based on PARP inhibitor activity in this population. And if that is validated, then I think the next step would be looking at this or exploring it in a maintenance setting or in a second-line setting.